After the age of 40, many people begin noticing subtle but undeniable changes in their vision. Small print becomes harder to read. You hold your phone farther away. Night driving feels more difficult. Bright light causes more glare. Eyes feel dry more often. Focusing between near and far objects takes longer. These changes can feel sudden, but they reflect predictable biological shifts that occur gradually in both the eyes and the brain. Vision is not controlled by the eyeball alone. It is a coordinated system involving the cornea, lens, retina, optic nerve, visual cortex, blood supply, and nervous system regulation. Around midlife, several of these components begin to change simultaneously. One of the most common shifts is presbyopia, the gradual loss of near-focusing ability. Inside the eye, the lens must change shape to focus on close objects. With age, the lens becomes stiffer and less flexible. The tiny ciliary muscles that adjust lens curvature must work harder. Over time, the lens cannot accommodate as easily, making near tasks like reading more difficult. Tear production also declines. Reduced tear film stability leads to dryness, irritation, and fluctuating clarity. Hormonal changes influence tear glands, especially in women during perimenopause and menopause. Decreased estrogen can worsen dry symptoms. The retina also undergoes subtle aging. Photoreceptor cells responsible for detecting light gradually decline in efficiency. This affects contrast sensitivity and low-light vision. Blood flow to the retina may decrease slightly due to vascular aging. Even small changes in microcirculation can affect clarity and recovery from bright light exposure. The pupil becomes smaller with age, allowing less light into the eye. This contributes to difficulty seeing in dim environments. Neural processing speed also changes. The visual cortex processes signals slightly slower after 40, making it harder to adapt quickly to changing lighting conditions. Chronic screen exposure plays a role as well. Prolonged close focus reduces blink rate, increasing dryness and digital eye strain. Blue light exposure late in the evening disrupts circadian rhythm, indirectly affecting visual recovery. Blood sugar stability influences lens clarity. Elevated glucose levels can temporarily alter lens shape and focus. Long-term metabolic instability may increase risk of cataract formation. Inflammation contributes to oxidative stress within ocular tissues. Ultraviolet exposure accumulated over decades increases risk of lens clouding and macular degeneration. Importantly, most midlife vision changes are functional rather than pathological. They reflect mechanical stiffening, tear reduction, vascular shifts, and neural processing adjustments. In the second section, we will explore how to protect visual clarity, support retinal health, maintain focusing flexibility, improve tear stability, and reduce digital strain naturally. Protecting vision after 40 requires supporting multiple systems simultaneously: lens flexibility, tear stability, retinal circulation, neural processing, and metabolic balance. The first priority is reducing chronic eye strain. The eyes are designed for dynamic distance shifts, not prolonged fixed focus at one near distance. Practicing regular focus breaks helps preserve accommodative flexibility. Every 20 minutes, shifting gaze to a distant object for at least 20 seconds relaxes the ciliary muscles and reduces strain accumulation. The second priority is blink awareness. Screen use reduces blink rate dramatically, sometimes by more than half. Conscious blinking restores tear film stability and reduces dryness. The third priority is optimizing lighting conditions. Harsh glare forces the pupil to constrict excessively, increasing fatigue. Balanced ambient lighting reduces contrast stress. The fourth priority is ultraviolet protection. Sunglasses that block UV radiation reduce cumulative oxidative damage to the lens and retina. The fifth priority is nutritional support. The retina has one of the highest metabolic demands in the body. Nutrients such as lutein, zeaxanthin, vitamin A, vitamin C, vitamin E, zinc, and omega-3 fatty acids support retinal resilience and tear production. Dark leafy greens, colorful vegetables, and fatty fish provide protective compounds that accumulate in retinal tissue. The sixth priority is metabolic stability. Stable blood sugar protects lens clarity and microvascular integrity. Managing glucose variability through balanced meals and regular movement reduces long-term risk of vascular eye changes. The seventh priority is cardiovascular fitness. The retina depends on healthy blood flow. Aerobic activity improves microcirculation, supporting oxygen delivery to visual tissues. The eighth priority is sleep protection. Overnight repair processes help reduce oxidative stress within ocular tissues. Consistent sleep timing improves recovery. The ninth priority is reducing chronic inflammation. Diets high in processed foods increase oxidative stress, while anti-inflammatory dietary patterns support vascular and neural integrity. The 10th priority is posture correction. Forward head posture during device use strains eye alignment and increases tension in surrounding muscles, indirectly affecting visual comfort. The 11th priority is regular comprehensive eye examinations. Early detection of cataracts, glaucoma, or macular degeneration allows timely management. The 12th priority is moderating digital exposure in the evening. Excessive late-night screen use strains focusing muscles and disrupts circadian rhythm, impairing visual recovery. The 13th priority is maintaining realistic expectations. After 40, lens stiffening is natural. Reading glasses or progressive lenses are not signs of failure, but adaptive tools that reduce strain. The goal is not to prevent every change, but to preserve clarity and comfort for decades. Vision after 40 becomes more dependent on circulation, metabolic balance, tear stability, and muscular flexibility. When these systems are supported consistently, decline slows significantly. The eyes are resilient organs. With proper care, visual function can remain strong well into later life. Midlife visual changes are signals of structural adaptation, not inevitable deterioration. Consistent protection, circulation support, nutrient adequacy, and strain management allow the visual system to remain efficient and comfortable.